Hi everyone, welcome to another Coronavirus TV episode. Very happy today to be bringing good news. The 17th of June, we finally have our first clinical trial for a treatment that shows a mortality benefit. I'm sure you would have heard about it, it's been pretty widely reported in the mainstream news, but this drug is dexamethasone. So the specifics, it's a trial run in the UK called Recovery. Had about 2,000 patients receiving dexamethasone and 4,000 patients receiving placebo. Clear benefit for dexamethasone treatments among patients that required mechanical ventilation. The risk reduction for mortality was reduced by 1/3. For those that were not on mechanical ventilation but still required oxygen, the risk reduction was 1/5. There wasn't any difference between placebo and treatments among more mild patients though. So once you adjust for the fact that placebo patients may actually get better anyway, combining these rates with that fact, it's been able to be shown that dexamethasone could prevent 1 in 8 deaths among people that do need mechanical ventilation, 1 in 25 deaths among those that require additional oxygen support. Just all we have right now is a press release. We don't have a journal publication yet, so obviously there's still many unanswered questions, and people are inherently skeptical because of many other institutions kind of rushing out data without having the kind of publication to back it up. I'm much more confident in this result though. I also expect that we're going to see a benefit for dexamethasone across a range of other endpoints. So mortality is the ultimate endpoint, but we know that COVID-19 can cause long-term organ damage. If it kind of stands to reason that if dexamethasone improves mortality, then there's a range of other endpoints that this drug will show. So to a certain extent, I'm actually a bit surprised that dexamethasone and other steroids aren't really routinely used and part of the standard of care already for COVID-19. Steroids are used among kind of ventilated patients. There's a long history of steroids being used in other inflammatory respiratory conditions. In my career as an analyst, I've spoken to key opinion leaders on this topic extensively before. Yet when it came to COVID-19, many of the treatment guidelines completely omitted steroids from their recommendations. And actually there was a suggestion that steroids shouldn't be used because they're immunosuppressive and the body's trying to fight an infection. But the point is, by the time patients get to the stage that they're requiring mechanical ventilation, it's not the virus that is the acute threat, it's more the immune response. So this is where steroids such as dexamethasone and methylprednisolone really play a role. So this trial will be really important in enabling the physician community to come to a consensus around, yes, we should be using steroids. This is the dosing regimen that has been shown to save lives. And because dexamethasone is such a widely available, already widely used and cheap medication, treatment practices can change overnight. And also ongoing trials and new trials will need to adapt to this. So it's not just treatment practices in hospitals, but those that want to run a clinical trial, we basically cannot, all patients who are at this severe stage should be receiving dexamethasone as their kind of new best standard of care. This might make it somewhat more complex for the IL-6 inhibitors and JAK inhibitors that have been investigated. They're not just being compared against placebo now, they're being compared against a really, really cheap treatment option that's been shown to save lives. So the treatment effect for these innovative drugs is going to have to be spectacular if they're going to really advance treatment practices above and beyond dexamethasone. The last point I want to make is actually a bit of a patriotic one, so please excuse me for that. This trial has two arms from this trial have produced data that's really changing treatment practices. So the Solidarity, so it's recovery trial, my mistake, it's clearly shown that dexamethasone should be part of the standard of care. This trial has also shown that hydroxychloroquine should not be part of the standard of care, and is part of the reason why the US FDA has recently revoked the emergency use authorization for hydroxychloroquine. So the UK is leading in terms of the generating robust clinical trial evidence for what we should be using and not using to treat COVID-19. Really is a lesson here that central oversight into our trial design, getting enough patients with standardized protocols, really it has value. And a lot of the initial effort into COVID-19 clinical trials being run by academic groups, perhaps on a small scale, just really hasn't generated the data that's really can inform treatment practice globally. So well done to the UK. Well done also to the NIAID, which was a part of the National Institute of Health in the US, which ran the remdesivir trial, which also showed that remdesivir can reduce hospitalization in patients with less severe COVID-19 as an antiviral. Doing more so than Gilead's been able to show in its own clinical trials. So again, its central oversight in clinical trials has been hugely important. Hopefully I've been able to add a little bit more to the topic than you might have read in your kind of main news sources. Hope you found it interesting. Certainly cause to celebrate, and I don't think there's any reason not to see this as overwhelmingly good news. So well done to the clinical trial investigators involved. Thanks a lot for listening, and I'll speak to you soon. Bye.